Estimated 1 in 5 Australian adults suffer from chronic pain, with the figure rising to 1 in 3 for people aged 65 years and over. What's worse, it is estimated that the crippling condition will affect 5 million people by 2050.
Pain is the most common reason people seek out medical help, yet remains one of the most neglected and misunderstood areas of healthcare. So where are we going wrong, and how can sufferers get relief?
For more on this, we are joined by Dr Karen Phillip. Karen, lovely to have you on the show.
Thank you.
Hi, Karen.
Just to begin with, what exactly is chronic pain? How does it differ from just sort of an everyday ache or pain?
Okay. Chronic pain is pain that lasts for 3 to 6 months, and it's often still prevalent after the illness or injury has improved. Our pain receptors continue to send us messages that the pain or the issue remains.
Okay.
Right. Studies say that women experience chronic pain more than men. Is that true?
Well, they do. However, I believe that women are simply more... they go to the doctor to find out what's wrong and how to feel better. Men seem to withdraw from going to doctors, or they self-medicate, we might say. So I don't believe women are more receptive to pain. In fact, I think women's pain threshold is probably greater than that of a man. Yet the statistics do show that women do go to their doctors more often because of pain.
So what is the connection to mental health issues? It becomes a mental health issue, as you're saying, that the
yes.
pain or the injury has actually cleared, but the person is still imagining or feeling that they
feeling
are feeling pain. Yeah,
exactly. When we're in continued pain and constant pain, we are overwhelmed by that feeling. It encompasses every part of our life, our relationships. It creates anxiety, even depression, because it is so difficult. We can't do the normal things we used to do. We can't get out and play with the children, undertake our sport. We sometimes can't even work. We struggle to do everything, and that's why it's so debilitating.
Yeah, look, we only had a story earlier in the program where prescription drugs are killing more people than heroin, which is alarming in this country. I mean, what's your take on something like that and our dependency on painkillers for chronic pain?
Well, unfortunately, we've not been given an alternative. When we go to our physician and it's like we've got something, we've got pain, then we're prescribed a medication. There are, well, we all know how many advertisements there are every day on television, even on radio, in regards to different pain medications. They inundate us. We don't know that we've got other options available, and I use clinical hypnotherapy to alleviate pain in people, and clinical trials have proven that hypnotherapy will really reduce and diminish the feeling of pain long term for patients.
And so what sort of, I guess, improvement have you seen in some of your own patients with hypnotherapy?
Enormous amount of pain. People that have coming in that are often quite crippled with pain, we do a session or two with them and they're feeling freer. What we do with hypnotherapy is we take the focus away from the pain and we put it elsewhere. So once we no longer are consumed by the pain, no longer thinking about it continually, then it diminishes simply. Now we're able to get on with life and do more things. We've developed sessions now that people can download online at virtualhypnotherapy.com, and what they can do is they can actually access the pain session regularly. So they may, I usually suggest people do it 2 or 3 times. If you go to a hypnotherapist, you do one session and that's great, you feel better. However, does it last long term? Well, I believe that we need to do a few sessions and maybe every few weeks do another session. So rather than going to another hypnotherapist or the same one over and over again, we simply download the session, keep it and use it as often as we need.
Yeah, I think the message, Karen, is if you are feeling chronic pain, be open-minded to seeking alternative treatments.
Absolutely, and take control.
Karen, thank you so much. It's a very interesting topic. Lovely to see you.